Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today, I'm delighted to be joined by Dr. Monica Gandhi. She is the Professor of Medicine and Associate Chief Division of HIV, Infectious Diseases, and Global Medicine. Monica, thanks for joining me today.
Thank you. I'm happy to be here.
So I think you're very well known in many circles. Your primary area of interest and work that you've done over many, many years has been HIV. That's come to the forefront with all of the things that are happening with COVID-19, the pandemic. This is now another pandemic. As we look back at HIV, last time I looked, it was about 36 million people had died from HIV. It's changed dramatically. As you think back over the course of the work that you've done and the incredible progress that we've made to HIV, tell us a little bit about what you think that teaches us around COVID-19 and what we can apply moving forward.
Well, you're right that it is the 40th anniversary of the first description of AIDS this year, 2021. 40 years ago, June 5th, 1981 was the first description of AIDS. And though there's still 37 million people living with HIV, it is important to remember that actually 37.2 million people have died of HIV infection since the beginning of the pandemic. So this is very much still with us. Over 5 million people have died from COVID, but this is a longer standing epidemic, HIV, and it is not over yet by any description. I think that what I learned from HIV as being an long-standing HIV doctor and watching also the policies around HIV and the politics was that a harm reduction approach where you actually advise people on how to avoid a pathogen like HIV, but still live within the parameters of their needs, of their sexual needs, of whatever is happening in their life, and advise on how to stay safe, but still live, was the most profound thing that we did in HIV. We risk stratified particular activities. This is a low risk activity, this is a high risk activity, and we advised people accordingly, and it really gained the trust of the community. What happened in COVID is that there was this idea in many countries, in most countries actually, not all, like Japan didn't do it this way, but some countries just said there is no other way but to just stay away from other human beings to stay safe from COVID. Even when we knew so much more after 3 months about cleaning not being necessary and fomites and surface not being a thing, and transmission, and the idea that was somewhat generated that the only way to stay safe was to stay at home and not be around other people, as opposed to, okay, if they're essential services, let's keep them open with COVID mitigation procedures in place, like masks and ventilation. We just used a kind of abstinence-based approach. And that doesn't work for human beings, and it didn't work in COVID. And anytime there were more restrictions, like closing the outside, which wasn't reasonable in some places, then people would go inside because people needed to be together. And so I think what I learned is that I'm surprised that we didn't take some of our lessons from HIV, which was also to think about risk stratification. Younger people with COVID are less at risk. These groups are less at risk for HIV, and work accordingly. Instead, we used kind of a blanket approach in many countries, and I think it backfired.
I guess I'm surprised, but I'm not, because I read the 1918 pandemic book that was published pre this pandemic, and I read it as if I was reading the same thing about this. We failed to learn from that one, and that was 100 years ago. We just seem to consistently ignore history, despite the fact that it teaches and informs everything moving forward.
Well, that's actually a really good point. And I looked myself at the 1918 pandemic playbook the other day because I was doing a talk on school closures and for the pediatrics community here at UCSF. And what I was very amazed by historically is what happened in 1918 was this absolute focus on children. Even though influenza, unlike COVID, affects the young and the old, COVID is very gradated. It's you're much more likely to get severe disease in much older ages, and the young are really relatively spared, especially children. And yet, at least not in Europe and the UK as much, but the US really did really close schools. They just did. And they did it politically, and they did it along political lines. Democrats closed schools and Republicans didn't. And the amazing thing about what happened in 1918 is the very progressive societies. So New York City was a good example. They were told, the public health officials were told, you better close schools. You're going to cause transmission of this highly infectious respiratory pathogen. And the public health officials in New York City, where there were 1 million children in the public school system, said absolutely not. Children need school. They need it for their learning. They need it for their socialization. And they need it for their food. 750,000 children in the 1 million public school students really did not come from affluent families. And they said, no, we will not close schools. And New York City, Chicago, New Haven, they did not close schools. And then anywhere else, they closed schools, but then they opened them as soon as they could. So that was what happened in 1918. And here we have COVID affecting children so much less. But again, often politically, schools were closed worldwide. And UNICEF kept on saying, stop, open schools. No, this is really hurting children. But there was this profound fear of COVID. And I don't actually blame it on politics. I blame it on our messaging. Our messaging was somehow you're going to get COVID and die at any point. Like that is so non-subtle. Like, no, you're much less at risk when you're this age. You're much more at risk when you're this age. These are the risk factors. These are the way to stay safe. Just message it properly. But it was really fearful messaging.
I think, in hindsight, it's always 2020. It's clear there was a failure in a lot of messaging from government organizations, from specialist professionals. And we saw that with HIV. I remember that vividly. And you brought back a lot of those memories. I remember that touch was one of those areas. And yes. Lady Diana was one of the people that really tried to stand up and change. And you brought it up talking about cleaning.
People with HIV. I remember that. Yes. In the UK,
it was part of her,
yes,
just being, was to say, no, this isn't the case. But what I recall from that was it took a long time, even with the impact of leaders like that, to change the opinion. And I feel like the same thing, because I get on planes and I'm hearing that they're cleaning everything down and we've got wipes, yet we know that that's not the case. How are we going to change opinion so that we move forward with science? We've changed our view and understanding. We need to change it. How do we get people to move quickly with us? Because that's what we need to do to open things up.
In fact, not only do we need to do this, but it's imperative to do this for mental health and for the emotions that this pandemic has created, along with the terrible illness that it's led to. There's been amazing after effects. Measles vaccines down all over the world, HIV out of control in many places, tuberculosis for the first time, mortality rates went up this last year, malaria. I mean, it is important. It is not, and then everyone's mental health. So this is how I see it. And it's really interesting. You just talked about Princess Diana at the time, who was a model figure who did this. She was brave, and she showed that you can embrace people living with HIV. That was not how it was transmitted. I think we need leaders, and I don't mean political leaders. I think we need the leaders that are that led the response. Neil Ferguson, Anthony Fauci, people in countries that led the pandemic response, to come out and be extremely clear about risk stratification, how it's not once you're vaccinated, there are so many, these vaccines are working great, to give a profound security in the vaccines, and to say things like, I'm going to just list the things that we need to stop doing. Stop cleaning this, stop being scared of everyone, you don't need to wear a mask in these settings. There's I actually think that's really important. And when I think about, for example, your country and mine, the same thing happened. A politician who was a leader of the country looked like they were minimizing COVID, at least Boris Johnson at the beginning, and certainly Trump almost throughout. And because of that, there was an overcompensation by science-based leaders to say, we're not only going to minimize this, we're actually going to not even be subtle in how we speak about and science-based in how we speak. We're going to go all the way over, this is just so scary that we're going to inflate some of the fear-based messaging. And that was purely politics. I mean, if we had just purely based on the science, we could have opened schools much earlier in the US. We would have known the mitigation procedures. We'd stop wiping everything down. We'd stop making people scared of each other. So that became political in the UK and the US mostly. I really saw those effects there. Whereas in Denmark, sort of calmly messaged risks, apologized when they kept the schools open, closed for 6 weeks. When the prime minister opened up, said, so sorry that they were even closed for 6 weeks, and got everyone to agree to take the vaccine because there was just trust generated. This kind of back and forth where science-based leaders think they need to overcompensate for politicians who don't look like they're taking it seriously enough, that led to distrust on both sides.
Yeah, I think that trust element is a critical part. And you bring up Denmark, they're interesting, a very high trusting society, unlike some of the others that you've talked about. They did a really good job right up until the mink farm issue that I think broke a little bit of that.
That's true.
And, the question is whether they can recover. But I agree with you that transparency is essential. As you think about it moving forward, and I know, you talk about the school closures, you obviously have young children. You think about this not just from a professional standpoint, but from a personal standpoint. Tell us your thinking about school closures and that stratification of risk for parents who are now all struggling with vaccination is available, getting vaccinated. Am I safe? What should I be telling my children?
Well, that's a very good question, because if we've broken trust with parents who, at least in many places around the US, there's been a breaking of trust with parents that when there was messaging done about COVID by major public health organizations, we didn't clearly say, okay, this is the risk when you're 80, this is the risk when you're 70, this is the risk when you're 60. And actually, it's very small when you're young. Why is the risk so small when you're young? Two reasons, actually. There's something to do with the receptor that takes in the COVID virus. So the children don't have this ACE2 receptor in as high of density in their noses, so they're less susceptible to it, which is really different than influenza. And then the second reason is, and this was just in a Nature paper recently, that their innate immunity actually is not dysregulated like older people's can be, that led to so much of the inflammation and the illness of COVID. So they have very good innate immunity to control pathogens in the lower respiratory tract, this particular pathogen. So all of that meant children were much less at risk. And so because we didn't message that, because we used fear-based messaging, teachers were frightened to go back. Even adults and parents were frightened to send their children back to schools when they did open. And then it's just clear that this epidemiologic association is there, that children are less at risk. And now we're saying get the vaccine. And if that trust has been broken, where parents say, but you exaggerated the risks for my children. You exaggerated that they were more at risk for being in school than they were at home with the mental health effects and learning loss of not being home, then why would I get the vaccine? And that trust has to be rebuilt. I do think that getting a vaccine, and I've written about this, I'm planning on vaccinating my 11-year-old, which we have the 5 to 11-year-old vaccine here. Getting the vaccine is important for children, not because they're at high risk, but because even a little bit of risk, if you could eliminate that risk, because there were some definitely, actually, you only had 25 children die in the UK per a Nature medicine study under 17. This was just published on November 8th. And much higher, of course, for adults, 100,000 in the same time period for adults. So 25 children, it was 0.8% of the deaths among children over that year. So much less risk. But that is 25 children. There is 897 children here in the US as of this date who died from COVID. If you could eliminate a risk of anything for a child and the vaccine is safe, that's why we're encouraging parents to get it. Second is to decrease transmission to others, which I still think is a very fair thing to ask of young people. And we've asked that of young people for many of our vaccines that are not specifically children are most at risk, but the older adults that they're around are more at risk. So that's a good enough reason for me. And when you opened up in the UK more vaccines to younger people, that was, I think, a good thing for reducing cases. And then the third is that they grow up and also that they will, having this immunity now is good. So I really do think parents should get the vaccine, but there is distrust, and we created that distrust. And that's what I'm worried about, is we created the distrust by this idea of abstinence-based, stay away from each other. That's the only way to stay safe. Keep schools closed, keep businesses closed. That's the only way. That was so not correct and not harm reduction.
So for those of you just joining, I'm Dr. Nick, the Incrementalist. Today I'm talking to Dr. Monica Gandhi, the Professor of Medicine at UCSF. We were just talking about children, vaccination principles. As we think about the future, where do we go from here? This is not going to disappear. We're going to move to endemic. What are our best sort of approaches to this, and what's realistic? I think we're struggling with this, and we look to folks who've had the experience to be able to say, this is a reasonable course that gives us back our lives. That's what we're all looking for, that human contact, as you importantly describe, and that mental contribution. But it's unclear how we're going to achieve that. How do we get there?
I actually have a very strong and clear and simple solution to how to get there, in my opinion, which is that with an endemic virus, where the virus is not going to completely go away, and I don't think any country in the world except China is pursuing any strategy that is thinking about elimination. It means endemic. It means it's going to be around. It's going to go up during the winters because that's when people gather more. It's going to go down when it's better. Respiratory viruses, that's how they work. However, we are doing something right now that is not going to allow the transition to endemicity and acceptance, which is we are counting cases. And if we exclusively focused on hospitalizations as our marker of what is happening with the infection and the disease, we would know which populations to boost. Instead of saying boosting everyone, we would know what to do with immunocompromised and older individuals. We would say during the winter, I would recommend people who are older and immunocompromised mask in crowded indoor settings. But we would stop staring at cases, which was an important marker to follow before when we were in pandemic stage, because they were almost not completely, but they were tracking with hospitalizations. It was really your country actually that showed with the Delta variant, where you opened up full on in the middle of a Delta variant surge in July 19th, you showed that delinking was occurring, that decoupling between cases and hospitalizations were occurring. And now the relationship between cases and hospitalizations is so complex because there are vaccinated people who are being hospitalized. Those are the ones that most at risk and need a booster. There are patients who, if there's a lot of virus around, they'll get a severe breakthrough. We have to focus on protecting them. And there's still people who haven't trusted the vaccine and gotten the vaccine. So all of that put together means if we focus on hospitalizations instead of cases, I think it's a very easy transition to endemicity, because in a place like the UK where hospitalizations are, when they're under control, you don't impose restrictions on society. And I mean masks or gatherings. If hospitalizations increase because there's a new variant, because the vaccine needs everyone to be boosted, that's when you start imposing restrictions. But it's the focus on cases if we will never get away from it if we don't make this transition.
So why do you think there's a decoupling between the cases and the hospitalization? Is it because we've gotten better, we've got the vaccinations, that's essentially improved the outcomes, so there's now not the same linkage and you don't see that tracking?
Yes, I mean, it's pure and simple. Like the purest way to say it is vaccines generate T cell immunity, antibodies and B cells as well, but T cell immunity to the virus. T cell immunity protects us from severe disease. And that tracking no longer happened like that when you got mass vaccination programs into play. So Singapore, Portugal have a lot of cases right now. Hospitalization staying flat. It is very important to, if you start tracking hospitalizations, you won't frighten society with cases. You actually, frankly, in the UK, test a great deal and have a lot of access to testing. But is that really the marker of what public health needs to protect people from? They need to protect people from getting sick. And that somehow we decided, which I understand why, because there was asymptomatic spread, we decided to do mass testing. And that was very fair before vaccines. But after vaccines, if someone is perfectly well and they really can't pass it on because they're fully vaccinated, what is the point of putting a swab in their nose and seeing if they have the virus in their nose? What the point of public health has always been to prevent illness.
Absolutely. So as you think about the future, one of the things that I've heard you talk about extensively bothers those of us that think about this is the equitable distribution of this. Okay, so perhaps we fix it in some of those countries, but how do we go about this? It seems like it's a worldwide problem, as is HIV. There is no barriers, no borders for any of this. How do we fix that?
I think we will look back on this time and see this as a profound moral and ethical failing of countries like yours and mine. We have, of the vaccine doses that are available right now, of the 7.25 billion doses that have been given out as of today, November 17th, 4.7% of them have been given out in low-income countries. So many of the cases and deaths in 2021 were preventable if not for people who declined vaccination. Those were unfortunately, you couldn't get people to take the vaccine in some of the rich countries, but for those who desperately wanted the vaccine and died, those were preventable deaths. And there is no way that, I believe I read recently that each of our countries have 6 doses for every one of our citizens just sitting there, 6. So you have 6 doses, a child has 6 doses rating. And of course, 241 million doses, according to MSF, Doctors Without Borders, will be wasted by end of 2021, just put down the drain. So beyond the variant issue and the public health implications that we're not safe until everyone's safe, because God forbid another variant comes out that is more transmissible than Delta, it's just morally and ethically, I think it's one of the most profound failings I've ever seen in history. I almost every day, I have declined to take a booster shot, by the way, even though I'm a healthcare worker, because I can't look in people's eyes. I meet with a Kenyan team do HIV work abroad, and I can't look them in the eye and say, I'm going to go get my 3rd shot. Oh, sorry, did you get your first? It is impossible to imagine what's happening now. So what can we do? So, the World Health Organization and Doctors Without Borders are large organizations, and they are every day beating this drum. I think that we need to be citizens advocates, like in the way that we were in HIV. In HIV, what changed the equation for antiretroviral access to sub-Saharan Africa? It was advocacy by HIV activists. That's what it was. It was marching in Durban and saying, I'm not going to take my pills until you can get your pills. And it was advocacy by people like you and me, actually, clinicians and people who were, anyone who's susceptible to COVID would be every single human being doing advocacy. So I think I'm actually going to start something. I'd like you to be involved. I just talked to another UC school because I'm in the UC system, University of California. We're going to start something, trying to figure out, like, not in my arm until it's in your arm, something, and we are going to start a very major advocacy organization. We need to rally.
What a rousing thought to finish on, and a concept that says, instead of people gathering and saying, I'm not taking my vaccine, people gathering and saying, I'm not taking my vaccine because I want that vaccine to be widely available. I think that's a really positive note to finish on. As usual, we've run out of time. It is such a pleasure. I know how extraordinarily busy you are.
Thank you for having me, though. That was great to talk to you.
So thank you very much, Monica. It's great to have you on the show.
Thank you.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.